You know, imagine if your child's got an issue and you just can't provide a solution for them. Just the desperation that brings is really palpable sometimes. You know what it's like as a parent yourself if your child hurts themselves or has a problem, and you know you do your utmost to try and find a solution, try and find help for them. And you know, we're lucky enough to live in a country where that's available.
Well, essentially, Semesa is the only plastic surgeon for Fiji, and it has a population in excess of 800,000 people. Tasmania, for example, has a population of 500,000, and we have 12 plastic surgeons. So there definitely is scope for more plastic surgeons in Fiji.
I think one of the difficulties of being in Fiji is that you're isolated. You don't have another colleague to talk to discuss things.
The whole idea of what we do as Interplast is we really want to eventually do ourselves out of a job. And it is my desire, like I've already been working for them for 19 years, I would like to get to the point where I would have a local expert, and it may be someone like a Keezy, you know, someone who has actually has the passion and the thought process.
My mom was diagnosed with diabetes mellitus type 2 in the year 2000. So when we came here, I saw that it helped her so much that she was able to walk again. But then the disease kept deteriorating her life even more. She had end-stage kidney disease, so she passed the following year. So I told myself I was gonna give back to the community, and this taking up physiotherapy course was for her. That's right.
Siriana is a 9-year-old Fijian girl who was born with a bilateral cleft lip and palate, quite a big defect in the center of her face going through into the palate. I think she was quite shy, and I think the kids in her school teased her. That's at least what she told me, and she was quite shy about that. She'd previously had the lip and palate repaired in Fiji by another visiting team, and the palate repair went really well. The lip repair not so well, in that the lip repair came apart on one side, and through that projected her central upper teeth.
So it's been 2 years now, because it was supposed to be done last year in November, but we couldn't make it because I just gave birth to my daughter.
So did she have difficulty? Unfortunately, these teeth had been exposed to air, and the enamel was damaged, and these teeth were rotten, and in fact even the roots were rotten, and in the sort of central segment the bone had sort of quite dissolved away and it was misshapen. So we thought the only way we could re-repair the lip was to remove the rotten teeth, get them out the way, take away the dead rotten bone, and then re-repair the lip. To be able to repair the lip again. Hopefully
one of the most satisfying elements of working with Interplast is actually trying to pass that knowledge on to the local surgeons that we work with. And they're so hungry and keen to learn as well, and you know, they're really ripe for teaching. And I've always often heard it said from teachers that they really enjoy adult teaching because adults are so interested in learning, and I think the same applies in this situation. It's really great seeing young, keen surgeons overseas that are wanting to learn and very open to being taught and mentored.
I've always enjoyed working with tools, and I thought I would enjoy orthopedics more, but that changed in 2007 when I was attached with Interplast in Lautoka. the way that they moved tissue around and did the surgery. Initially, as a young registrar, you thought that it was just mutilating skin, until when you started suturing it and then came back in, it formed really nice, and you think to yourself, how did that happen? You know, just something created of something, like a lot of cuts, and you created something beautiful in the end, and it was really mind-blowing to me. And that's kind of what really sparked, and there was actually a burns contracture that started it, and then moving on to more different things like a cleft lip, which is even more different. Yeah. So that kind of really sparked it, and from then I've never looked back.
So at the moment we have Grace. Grace is in the burns unit. She's a plastics case. She had a chainsaw injury to her left arm, which hit her brachial plexus. So when she came in, I went to make a posi splint. I made a posi splint, so I went to fit it on her. When she saw me, I could see that grumpy look. So I walked up to her. I thought, "Hi Grace, my name is Akisi. I'd like to fit this posi splint on your left hand." Then she said, "Are you a student?" I said, "No, I'm not a student, I'm a volunteer physio. Can I trust you?" So when she asked me that question, I felt so emotional. So I told her, "Yes, you can trust me, I'll put it." "Why would you want to put this on?" Like from day one, when I met Grace until now, when she goes into surgery, she would ask me, "Are you gonna come with me to surgery? Are you gonna be in the theater?" That confidence, that trust we build, I can't even build with anyone here in the department. It's not something you see every day. But when a patient trusts you, without knowing where you're from, or your mom or your dad, this is just amazing.
Normally at the end of our general surgical training in Fiji, we go for an 1 or 2 year attachment in Australia and New Zealand. That's when I met up with the head of department, Mr. Frank Kimball, who took me, and I worked closely with him and other consultants, and it took me a good 1 year to really get the basics of plastic surgery, to change thinking from my general surgeon to think more like a plastic surgeon.
When I was a young trainee, I was nurtured by senior colleagues and mentored and given really good advice. And now that I'm a senior member of my community, I feel it's time for me to give back and mentor somebody else and help them on their career. Well, it's very interesting because I've known him now for 7 years, and when I met him he was fairly junior, and I've just seen this young man blossom into a very capable surgeon who works under extremely difficult circumstances and does a superb job.
So I think one of the benefits I've had since I've assisted a lot of the senior surgeons is that I've learned a lot from each of them. There's only so much a textbook can tell you, but while operating, the things that they can teach you that are not written down. So seeing that and also hearing that from a different senior surgeons has actually helped me. I've kind of had like a slumdog millionaire effect, where I take a little bit of this, a little bit of that from everybody, and that makes you grow as a surgeon.
In my career, I've been very fortunate myself. I work in Hobart, and I've worked for with the plastics team in Hobart for 35 years now, and I've been the recipient of amazing mentoring from the surgeons that I work with. So I felt that it was actually an extension of what I've received and what I do in Hobart to actually come to the Pacific and help do the same thing here. The skills that we've been trying to develop in the students are about clinical reasoning. So we want them to be able to think about what they're doing rather than treating things by recipe. So they have to actually be able to assess the patient, work out what their needs are, how to actually get them to the point where they're actually mobile and safe and back to work and back to home, managing their family, looking after their family. So I now see that happening all the time, whereas in the past I would be, it might be a year between visits and I'd come back and it really hadn't actually progressed.
Before operation, she was very excited. And when I was explaining to her that they'll remove that, what you call the teeth, she was very happy. When she entered the operation room, like she was a bit scared when she saw all the screen, all the machine inside. But she said that she's going to, when she'll wake up, she'll see a change. And I was telling her that when you will wake up, you won't see this thing again, the teeth that is shown there.
A lot of the surgery is staged because sometimes the tissue won't survive another procedure at the same time, so you have to do a procedure, wait for it to heal, let it all settle down, and then you can do further procedures on top of that.
The process of training to become a plastic surgeon and, for example, doing a cleft lip operation is a slow process. You start off, you're assisting, then you might put in 1 or 2 stitches, then you might do a part of the operation. So, you're not thrown in the deep end. But, there comes a day when you've got the patient and you're in charge and, that's it, and it's your first case. And, I remember that quite clearly. I was excited, but I was also, quite nervous, thinking, what I do will be on this child's life, this child's face forever. And it was a boy. His life will be, forever affected by the next couple of hours. So you do certainly feel a large burden of responsibility. Yeah.
Good morning.
It was really in 2014 that Mr. Kim gave me the push and said that I should start doing them on my own. That I started to do them on my own, and we've taken cleft in Fiji to a different level.
But interesting, back to grass got coexated, so we're giving him extra. Actually, there's so many examples of him really blowing me away with his work. For example, yesterday I saw a child that he'd done a cleft lip and palate repair on, and he'd just done a superb job. I was just blown away. It was just such a good job. I was very proud of him.
After that, all this coming back to start a new department or start to become a boss is actually quite overwhelming for a lot of us as young surgeons, but I was happy that Mr. Kimball came back with me for about 3 weeks to help establish the plastics department. So not necessarily operating, but all the things about administrative work, that a lot of things that we haven't been prepared for in our surgical careers.
Semesa is busy mentoring his own set of junior surgeons who've expressed an interest in becoming plastic surgeons, and they are coming up the rungs as we speak. So I think the future's bright, and I think he will now take over that mentoring role himself.
I think a lot of the surgeons have helped me with confidence to talk out a bit more, to share what I've learned in a short span. But there's still a lot of learning left, and so this mentoring program has been very, very good to me. We have a lot of difficult cases that we keep for the mentoring program, a lot of challenging cases.
Akizi, who I'm working with this week, is a perfect example of a new graduate physiotherapist who's confident and has the ability to actually treat these patients, the plastics patients, and it's something that in a country like Australia, it would take years for a person to actually be given that opportunity and to get to that level. But we know that these students now have those skills as new graduates.
The relationship we've built with Jen is just out of this world. She had been guiding us by the way we think, first of all, the way we think. And physically, what these people see when we make splints, that's just the outer bit of it. But inside, deep inside, we knew that she played a huge role. She played a huge role in our lives, myself and Kuresha. And we are running the plastics department alone, and we are volunteers. We hear words, we hear what people say because we're still volunteering. But her every day to Jenny to allow us to learn more and give us these praises that just keeps us going.
So what we find now is that we have people such as Akizi, who I'm working with this week, who will contact me all the time in between my visits. She'll be sending me little messages through the day. My phone will go ding and I'll look down and it's a photo of a patient or a story about a patient, and she just wants that reassurance that what she's doing is right, because really she's spot on. It controls the temperature and the circulation, but also the nails.
And my plastics patients, my burns patients, they are waiting for me out there. I don't want to lose that trust I have built and that confidence in making splints, in giving them exercises, prescribing good exercises, and following up discharge plans. All that we've grown as a department with Kuresha to come this far, and we don't want to. We don't want anything or anyone to stop us continuing. Is this one? Is this sitting? I would give anything. I would give my all. I would stay up late at night, make a splint, and if I see the reward is good, I'll keep going. Because this is just the beginning, and it's just 12 months into plastics, and I can see a brighter future in CWM for the plastics department.
I'm actually lost for words to say how rewarding it's been. But I felt that I've contributed to his career, and I've contributed into what he can do as well for his own country.
Structure. Yeah. So we look forward to building our unit, to making more people who can be stationed probably in Lotok and Labasa, and also some more in Suva. Yeah.
As far as doing these trips go, you know, that sense of contributing and helping is obviously very satisfying. But I think really the key reason for that I myself, and I'm sure a lot of the other Interplast volunteers go along, is that the sense of satisfaction and personal happiness that you get is only really experienced through giving. And giving can be financial, it can be you're using your skills, using your time, using whatever resources you have, but actually that at the end of the day is what makes for a good life. And that's what we all seek.
Well, the outcome actually was better than I expected. I anticipated some difficulties, but until you've taken it apart and had a look and done whatever you needed to do, you don't really know how much tissue you're going to be left with to be able to re-repair the defect. And fortunately, there was a fair amount of tissue still present, and we were able to close it quite satisfactorily. For all intents and purposes, she now looks virtually normal, so I think we'll integrate far better and probably have far less teasing. Good morning.
Oh, I'm so excited. I'm very happy. I'm overwhelmed with the team, with the doctors, the big change that they've made with my daughter's lip. I just want to take this opportunity to thank the doctors, thank everyone for their big work that they have done to my daughter. I'm just very, very happy, and my family is at home. They are looking forward to see her when we will be discharged from here.